Did y'all know this, tea? Did y'all know that they have the injectable PrEP now? Apparently, this ain't even no real new tea, honey. This news story is like a year old, a couple years old, honey. Baby. Child, they didn't approve it, honey.
Medications, and we'll use brand names here. I normally don't like to use brand names, but we'll use them when so that they're more clear for patients in the community. So one is called Cabenuva. That's the medication that's used for HIV treatment, and the other is called Apertude. That is the medication that's used for HIV prevention. What they both have in common are that they are both what I describe to patients and my colleagues as deep intramuscular injections. So they're a little different than your regular intramuscular injections. They have to be done by nurses who have been trained just a little bit differently to make sure they do it the right way. So they're both these deep intramuscular injections. They're actually both now available as bi-monthly or every 2-month injections. They actually sort of follow the same schedule where you're given your initial injection, you're given one month later as a loading dose, and then you take an injection every 2 months, every 8 weeks, essentially. The big difference between these medications is first of all, for HIV treatment, it's a combination of two medications, so it's two separate injections, one in each buttock, one medication in each buttock. For HIV treatment, for Apertude for prevention, it's just the one injection in one buttock.
Dr. Cantor, you really set us up really well because I think you clearly have a clear sort of centering of your patients and the way that you're sort of talking about things. Because I think one of the first things that I'll say about long-acting injectable is it is exciting. I also, as a community advocate, am very cognizant of the price issue with this. So when you're looking at $22,500 a year for Apertude compared to less than $20 a month for generic TDF-FTC or generic Truvada, this is going to be a complicated intervention to get to people. And I do worry as a community advocate, given that there's such important adherence requirements if you're going to be on this, that community health centers are checking with patients and really making sure that they're not going to run into any sort of unexpected coverage issues or anything that's going to interrupt their ability to continue with their treatment in terms of all of this.
In the grand scheme of things, over $22,000 a year for a list price for an ARV is in the upper threshold of ARVs that are available for HIV treatment and prevention. So it's not an insignificant list price. If we talk about community health centers and their status as 340B entities, there's a discount available to purchase that drug for your uninsured population. And yet, even with the discount, the price is still fairly significant. So that's an important factor as community health centers look at budgeting and programmatic decisions on both routes, on both Apertude and Cabenuva.
All right, if y'all didn't catch the tea, basically what they're saying is that now they have an injectable PrEP. Before this FDA approval, PrEP was commonly taken Truvada, generic Truvada, which is a pill. Now they have this injectable, which is more longer lasting. The pill you take every day. The injection you would take possibly once every 2 months, I believe. Yes, drug given every 2 months rather than daily pill. Yes. However, the advocates bring up points. The advocates bring up points regarding pricing, number one. Like, yes, taking this you're taking this medication less often, but you're paying to take it less often. Now, when Truvada first started, when PrEP first started, I was one of the people who was actually involved in the PrEP trial. Maybe even before it was FDA approved. But anyway, I'm still here. I'm HIV negative. I've never tested positive. I haven't been tested in the past about 4 months, it's time for me to get tested again, because I am on PrEP. They have been warning Black and brown people that they will have less access to the injectable Truvada. Trans community may likely have less access to the Truvada or the injectable PrEP. The trans community, the Black community, the brown community may likely have less access to the injectable PrEP for social reasons. Insurance, dispensable income. Well, shucks, I guess the medication ain't even dispensable. But my whole point in bringing up me being involved with the PrEP trials is that PrEP is now free for most people, whether you have insurance or not. I'm not concerned. I personally think if it's not broke, don't fix it. I mean, we have Truvada. We preach about testing. We just at any queer event you go to, testing is readily available. PrEP information is available. STD prevention, transmission awareness. All of these things have always been available. You're just going to have your people who think with their libido. You're just going to have your people who have their moments of weakness. You're just going to have your people who live in the moment and simply don't care. You're always going to have your impulsive people. Because this is a health issue that has predominantly affected the gay community, the gay male community, I'm not concerned. I'm sure that they'll make this injectable affordable for everybody or more accessible because it's a gay male issue and white men run this country. A lot of white men are gay or closeted bi or closeted gay. Honey, baby, I'm not concerned, honey. As you saw with Aiden, we're an overly sex society, honey. Hookup culture has become completely normalized. Our whole sex positive movement is a whole fool and trash and promotes the spreading of STDs. It's the difference in being comfortable with your sexuality versus being overly sexed, being overly sexualizing of other people, having sexual repression issues, acting out of sexual trauma. All of these things tend to get conflated and confused with sex positivity, baby. But it's an injection. Y'all beware, it's an injection.